Welcome everybody to SOT Health and Wellness. I'm Doug, and today I'm joined with Gabby and Elliot. And today we thought we would talk a little bit with Elliot about the research he's been doing on vitamin B1 or thiamine. So, Elliot, tell us all about vitamin B1.
Well, it's quite a complex topic. Where would you like to start?
I think it's a good start actually would be why did you got interested in this subject?
Okay, so I became interested in looking at thiamine because when I was trained in nutrition, I never really learned much about it. And I came across an author. He's a physician working over in the United States, and his name was Dr. Derrick Lonsdale. And I came across a book that he recently wrote, and he was talking about thiamine deficiency and the various effects that can have on people's health. Now, when I was taught about thiamine, I originally thought that this was a thing of the past, that deficiency was common in the early 20th century, but then they eradicated that. It turns out that that's not the case, and that thiamine deficiency is actually really quite common in the Western world. And so I did quite a lot of research in this area, and most of the research was published by Dr. Lonsdale and his colleagues. And it turns out that they've, in the past, have treated multiple different conditions using thiamine therapy. And I think it's a very important topic in today's world.
When people think about thiamine deficiency, what are the usual classical diseases that come up?
Right, okay, that's a good question. So thiamine deficiency, it first presented, I believe, in Japan. And this was when the higher classes of Japanese, what they did was they started refining rice. So instead of eating brown rice, they would eat white rice because it was more aesthetically pleasing. And this was almost like a status symbol in society. And what they didn't know was that when you remove the husk from the rice, you actually remove most of the vitamins. So you present with just the starch. And what they started finding was all sorts of symptoms started cropping up. And typically a thiamine deficiency can lead to beriberi. That's one of the peripheral nervous system disorders. Likewise, another one is called Wernicke's encephalopathy. So this is like a psychosis. And so it can present in many different ways. It can present with cardiac arrhythmias or heart palpitations. There can be many different symptoms involved. It can affect the gastrointestinal system. So you can have constipation or diarrhea or something like that. Gastroesophageal reflux disorder. But there's also breathlessness and inability to concentrate, inability to regulate your emotions. And eventually it can lead to heart failure and many different things like that. And so once it was discovered that actually the reason why people were coming down with these nervous system disorders might have been due to this vitamin, they started fortifying the grains and fortifying the rice with the vitamin, and they found that actually it very quickly eradicated this disease. Since that point onwards, there's been a lot more research into the various B vitamins, and it's been found that when you refine foods, you take out the vitamins, you can really lead to deficiency states, and they can lead to all sorts of diseases. But again, if you speak to any conventional medical doctor, they would say that thiamine deficiency is a thing of the past. Now that we fortify our food, it's no longer a problem. Whereas, again, this isn't necessarily the case.
I think a mainstream doctor will only think about or alcoholic people get like Korsakoff Syndrome. They will think, oh, thiamine deficiency. That's Korsakoff Syndrome is also related then.
Yeah, it, as you said, it presents with long-term chronic alcoholism. Also anorexia, that is one of the things where if an anorexic begins to refeed, they refeed on lots of carbohydrates. Typically, they will need extra thiamine, and I think that is something that medicine does acknowledge. However, when we're talking about thiamine deficiency, it needs to be noted that the end stage of deficiency is presenting with beriberi or Korsakoff's psychosis, but ultimately there are many stages along that, and you can have early stages of thiamine deficiency which wouldn't necessarily present as those syndromes. Okay.
And what was the name of this doctor that you mentioned?
His name was Dr. Derrick Lonsdale.
Derrick Lonsdale.
Yeah, and he practiced at the Cleveland Clinic. I believe he was part of the pediatric unit and he worked with children. But throughout his time there, he was also working with various adults and things like that. And he no longer practices, from what I believe. I think he's retired, but he wrote a very interesting book, co-authored with an endocrinologist, I believe. Her name is Dr. Chandler. And it's called High Calorie Malnutrition. Thiamine Deficiency, Dysautonomia, and High Calorie Malnutrition. And it's a very comprehensive book.
So the question is, it is not a thing of the past, this thiamine deficiency. Does it apply today for people in the Western world who you will think will eat enough nutrients and thiamine?
Right. So again, that's a good question. I think we need to go back to some basics and try to understand why we actually need thiamine before I can answer that question. So when we eat certain foods, our body breaks them down into their basic components. So you have glucose, you have fats, and you have proteins. And now to be able to turn those things into energy, we need enzymes. And let's say you consume some sugar, and your body will transport it into the cells, and it will go through lots of different stages, and they require lots of different enzymes. The end product will be usable energy in the form of what we call ATP. Okay, so that's what the cells need to do things. So for those enzymes to work, you need cofactors, and these are like helping hands, okay? And these are vitamins and minerals. So this is the reason why anyone who knows anything about nutrition emphasizes the importance of getting vitamins and minerals. And when we talk about thiamine or vitamin B1, thiamine is a very important part of those enzymes. So to be able to take energy from food, you need to have enough thiamine. Now, if we look at how nature works, it's quite clever really, because any food that we eat that contains glucose or contains protein or contains fat will also contain lots of different vitamins and minerals. And so it comes in the perfect package where we get everything that we need. Now,
the rice huts of the Japanese.
That's exactly it. If you're going to eat brown rice or you're going to eat grains, if you eat the whole grains, whilst it may not be optimal, you're still getting all of the vitamins to be able to process that food. Now, the problem is that when we start refining the food, when we take out the nutrients, we take out the vitamins and minerals, then you get the pure energy. So you get the pure glucose or the pure fat, but you don't get all of the things that you need to break it down. And now that becomes a bit of a problem. Now, if you look at the Western world today, what do people typically eat a lot of?
Refined foods.
Refined foods. So we eat fast food, we eat sugar, we eat white sugar. And these things have had, I mean, if you look at sugarcane, this comes with a vast array of different vitamins and minerals. The problem is white sugar does not. And so with the B vitamins, thiamine is one of those. They're water soluble. So what this means is you need a constant supply of them, and they're essential. So your body can't make them. So you need to get them from somewhere. And if you think about it, you have at any one point, you have a certain amount. So let's say you have a cup full of thiamine, okay, a cup full of B vitamins. And every time you have sugar or every time you have fat, you're using up some of that thiamine. Now, ordinarily, if you're eating whole foods like potatoes or pork or any of the other things that thiamine is found in, and it's found in many different foods, then every time you're using up the sugar, you're also adding in some thiamine. So you're keeping it in a balance. The cycle can keep going round. The problem is when you start consuming refined foods, you're using up all of the stored thiamine that you have, and you're continuing to put in loads of glucose. And it can get to a point where the body can no longer metabolize the energy because it doesn't have enough tools to do so in the form of vitamins and minerals. Okay, and so if we look at the uses of these vitamins, it's not only in energy metabolism. As I've said, you use vitamins and minerals to be able to break down energy, but if you look at thiamine, it's actually involved in many different things. So it's involved in the breakdown of amino acids. It's involved in the metabolism of fats as well. But really, what's very interesting is it's essential for the production of brain chemicals. They're called neurotransmitters, and one of them is acetylcholine. Now, acetylcholine is very important in nerve transmission, in thinking and cognition, and in nervous system function.
So that's where the symptoms of cognitive decline comes from deficit of thiamine.
Yes. Well, not only that, but this is a relatively unknown thing. There is research to suggest, and Derrick Lonsdale does talk about this, that thiamine is not only important for the synthesis of neurotransmitters, but it's also important to maintain the health of the myelin sheath and to maintain the health of the neurons themselves. And there is a part of the brain called the limbic system, and as part of the brainstem, this is a very sort of primitive aspect of the brain, and this controls
the emotional brain.
Yeah, and this really has quite a large control of the autonomic nervous system as well. And so the cells in that part of the brain are particularly sensitive to thiamine deficiency. Okay, and when there is no longer thiamine in that part of the brain, it acts in a similar way as if there was a deficiency in oxygen. And so we know what happens when there's a deficiency in oxygen. The cells die and they can no longer function. And so this is similar to what happens in that part of the brain when thiamine becomes low.
And does that mean that people can get more emotional, reactive, or have mood problems?
Yeah, so some of the symptoms of thiamine deficiency in its early stages are emotional instability, mood changes, can be feeling of depression, even schizophrenia and bipolar. These are all very common findings. But at the same time, whilst it can affect our emotions, it can also affect every other part of our body, because you have to understand that the nervous system is really in control of the vasculature. So it can determine how well the cardiovascular system is functioning. It can control really how many of the organs function. Okay, and so if we look at early stage thiamine deficiency, it can manifest in multiple different ways. One of the first symptoms is heart palpitations. But eventually the heart can enlarge to try to make up for what is perceived as an oxygen deficit. And this can eventually lead to heart failure. But you also have more benign symptoms such as Raynaud's. Raynaud's is the uncontrolled constriction and dilation of the blood vessels in response to different temperatures. But essentially, when there is a thiamine deficiency, it means that the nervous system can no longer effectively adapt to the environment. Okay, so temperature regulation becomes kind of skewed. There is there's a condition called postural orthostatic tachycardia syndrome. And this typically involves the nervous system being unable to control what the blood vessels do, and it can result in all kinds of symptoms. But this can also affect the gut as well, because we have to understand that the gut, to propel food from the stomach down the intestine, requires the nervous system to contract. And so in thiamine deficiency, one of the aspects of that can actually be like a small intestinal bacterial overgrowth or some kind of other gut dysfunction. And this can go unrecognized. So it's certainly very interesting. Pins and needles in the arm or any kind of other neurological based symptoms can actually be due to a thiamine deficiency.
And this is at the level of the nervous system and its complexity. Mm-hmm. Does it affect another system? Like, for example, hormonal, or can it make you susceptible to infections? Or?
Yeah, so when we look at thiamine, I've spoken about it being important in the nervous system, but also what can't be overlooked is its its function in energy metabolism. And energy metabolism occurs in every single cell. We have to understand that for cells to be able to do what they need to do, they need enough energy. Okay, and this applies to every single cell. And when you look at various diseases, what they're finding now is that there is actually a condition which is fairly similar in all of them, and this is defective energy production. It's called mitochondrial dysfunction. That's what the technical name is. But essentially what it refers to is that the cells can no longer make energy as well as they could before. And so if we look at what thiamine actually does, thiamine is really like part of, to keep it simple, you have various enzyme complexes, and thiamine sits at the top of the cell's ability to make energy. If there's not enough thiamine, then the energy production is really quite halted. Okay, and this again can be a really big problem. And so when you look at something like susceptibility to infection, what Derrick Lonsdale found was that people who he was treating had their immune function was completely skewed, and so they would be highly susceptible to various infections. And this is because the immune system, like every other system in the body, actually requires energy. Right. Okay, and so the integrity of a tissue, let's say, okay, for instance, you've got the bladder. So the cells lining the bladder, the mucosa, to maintain healthy mucosa and healthy functioning and immune functioning in that system, you need enough energy to do so. Okay, and what he found was that really many of the conditions that he was treating in the same way, and this was actually with the aim of restoring energy production. Mm-hmm. And so this is quite a new and novel idea in medicine, but the general gist of what I took from the book and the ideas that the authors were suggesting was that many different kinds of diseases actually have a very similar origin. It has to do with energy, and this can explain how something like thiamine can actually improve so many different conditions, right, which seem unrelated.
Everything that is related to mitochondrial dysfunction could be improved with thiamine supplementation. Yeah. How about these diseases which involve, chronic fatigue syndrome?
Right. So it's interesting that you asked that because there's quite a lot of research, thiamine being used in various different conditions, and one of those is chronic fatigue syndrome. So if we look at chronic fatigue its base really seems to be mitochondrial dysfunction. And the onset of chronic fatigue syndrome really, along with fibromyalgia, actually started to show its face after the onset of a specific kind of antibiotic called a fluoroquinolone antibiotic. Okay, and there's lots of information around that, but one of the aspects of that potentially is that fluoroquinolones are known to deplete thiamine. And so researchers have used thiamine successfully to treat people with chronic fatigue syndrome, and they've got very interesting results. There was one study on individuals with fibromyalgia, and it was a very small study. There was only 3 people in the study, but he found up to 80% in all 3 people. It was 60, 70, and 80% improved in fatigue and in malaise and in subjective feeling of well-being. This was just with the vitamin B1, and so they concluded that this should be sort of first point of call in many of these kind of conditions.
So how about, I wanted to know more about this fluoroquinolone problem, because fluoroquinolones are antibiotics. They became very popular, and right now they're telling us again, whoa, wait, too many side effects, leave them for last option. And fluoroquinolones, they include ciprofloxacin, levofloxacin, and all these antibiotics. Why does thiamine gets depleted when you use this?
I don't know if anyone really knows that. I can't say that I know the exact mechanism. Perhaps it is known. I'm sure that it does have a depleting effect. That's been documented. And from what I suspect, or from what I understand, it could have something to do with oxalate. That is another mechanism. However, That's quite complex in and of itself.
Biochemically speaking.
Biochemically speaking, yeah. So what we know is that fluoroquinolones do have an effect on the body whereby thiamine becomes depleted, and that they may inhibit the absorption of thiamine as well. Okay.
Will that contribute? Because one of the most common side effects is ruptured tendons of cypro. Will supplementing thiamine help reverse that problem or heal it? Or no?
This again is a very difficult topic to tackle, because that, I think, has to do with the metabolism of glycine and vitamin B6 and vitamin C. Now, yeah, it does get quite complicated when we're talking about that. What I can say is that I think there is a trickle down or downstream effect that can affect the metabolism of various B vitamins, which does have an effect on collagen synthesis and also has an effect on various other things like energy metabolism. I think that has to do with multiple mechanisms, and one of those is oxalates and another one is disruption of the microbiome. Okay.
Because we do need B vitamins, enzymes, as you call them, thiamine, in order to get like all the nutrients into our tendons, you know, and in our body tissues.
That's true. Yeah. Aside from the fluoroquinolones, there are also other medications that are typically prescribed for other things, which have shown to have a detrimental effect on thiamine metabolism. The oral contraceptive pill is one of those. Metformin is one of those. There are many others. I think non-steroidal anti-inflammatories may have an effect, but I'm not 100% sure about that.
Is thiamine something that you usually get from food, or does gut bacteria, the microbiome, also produces it?
I think it works both ways. So generally with a lot of the B vitamins, if not all of the B vitamins, they are produced by the microbiome. They contribute toward a certain percentage of our daily B vitamin intake, but from what I understand, the majority of thiamine intake will be from the diet, and that is assuming that the diet contains it, because if you're consuming refined foods, there's a good chance that you're not going to have as much in your diet. Another problem is the absorption, and so there can be many things which can actually mess with the absorption, the body's ability to take thiamine. And so one of those is you have various tannins or polyphenols in tea, which can have an effect. Coffee can also inhibit the absorption of thiamine in the gut. There are also sulfites and hydrogen sulfide. So let's say that someone does have particularly imbalanced gut bacteria, and they produce a lot of a gas called hydrogen sulfide. In animal studies, this has been shown to potentially degrade thiamine in the gut before it's absorbed. Now, if you've got someone who has absorption issues in the digestive tract, like celiac or Crohn's disease or something like that, this is also potentially going to inhibit the absorption of thiamine. Aside from that, there are also genetic transporter problems. So you have transporters which allow the absorption of these things. There are potentially going to be enzymes or mutations in genes which mean that certain people may not be able to absorb as much as others. Not a lot is really known about that yet, though.
Well, given that, I mean, that there are so many different things that can interfere with it. If somebody was, you know, thinking that maybe they had some symptoms of thiamine deficiency, or they had some tests done, what kind of dosages are we looking at if they wanted to start supplementing? Right, so to answer that question, I think we need to look at the different forms of thiamine first of all. So the typical dose that you would find, or the typical type of thiamine that you would find in a multivitamin, is a thiamine salt, and this is thiamine hydrochloride. Okay, so this typically has very low bioavailability, and when it's prescribed at so-called physiological doses, there's good reason to believe that not much of it is absorbed. Okay. However, Derrick Lonsdale did find that in certain cases for children, he could megadose thiamine hydrochloride, say at
300 to 600 milligrams per day, and this is a very high dose for thiamine. He found that this could have beneficial effects. However, when we look at how thiamine is transported into the cells, there are thiamine transporters, okay, on the cell membrane, which help thiamine actually get into the cells. And this is why testing can be problematic, because someone could have normal blood levels of thiamine, but the thiamine may not be able to get into the cells. Likewise, it may not also be able to be used in the cells. So this is why typical testing for thiamine doesn't yield very good results. Okay, now with the type of thiamine, you would want to try to find a thiamine that can get into the cells. And so benfotiamine, that is one that is typically used for diabetic neuropathy with very good results. This can be very beneficial, especially at high doses, and this has been shown to be more bioavailable or more readily absorbed than thiamine hydrochloride. This is something that you might want to use for things going on in the peripheral nervous system and the rest of the body. However, as I said before, many of the problems with the nervous system may actually be stemming from the brain. And so research has shown that certain types of thiamine can get into the blood, past the blood-brain barrier and into the brain better than others. So there is a formulation which the Japanese studied many years ago, and the actual chemical formula is tetrahydrofurfuryl disulfide. So that's a really big word, TTFD, I believe. And it's basically a lipid soluble one, so it's fat soluble, and it's been shown to get into the brain. And so that is typically needed in much lower doses. However, high doses, maybe 100 to 200 milligrams, can really help people. But what we need to know when we're talking about supplementing is that supplementing at normal levels, so physiological levels, which means the sort of levels that you would store in your body at any one time, has been shown to be really quite ineffective for thiamine, long stage chronic thiamine deficiency. Now, the reason for this is, or the reason that Dr. Lonsdale and Chandler cite, they hypothesize that what might happen is that when there is a chronic deficiency of a vitamin like thiamine, that because you have various machinery in your cells which use those things, if you have low levels of the vitamin, the machinery, the proteins and the enzymes are naturally going to be downregulated. Less of them are going to be produced to match the deficit. Does that make sense? Yeah. Okay. So in that case, the enzymes may be downregulated, but likewise, it may be that the transporters are also downregulated. And so what that means is that you can give someone quite a high dose of thiamine, but if there are not the transporters to be able to get them into the cells, and if once they are in the cells, the enzymes are not there are not enough enzymes, or there's not a high level of enzymes, then the chances are the thiamine that someone has is not going to be used, okay, and you may not be able to absorb very much of it. And so what they found is that, for instance, if you've got a case of beriberi, whilst you can get rid or deal with most of the symptoms, you know, by administering thiamine for a couple of weeks, Dr. Lonsdale found that you may need to do it for up to a year at very high doses.
Before you see the results, the time it takes for all the transporters to get created.
That's exactly what it is. So it's almost like sending a message to the body that we now have abundance of this vitamin, and that the body needs to adapt to that, and it takes quite a long time to do that. And so the body needs to understand that this is a consistent thing, and that it can match the requirement, and it can start to upregulate all of the transporters, all of the enzymes to match the level of the vitamin that you're getting in the diet.
That can take up to a year.
It can take up to a year, yeah, apparently, in the case of beriberi. Now, there are cases where Dr. Lonsdale, if I remember correctly, was treating many other different conditions, specifically children with postural orthostatic tachycardia syndrome, or POTS, and he was finding that you may not see benefits until 4 or 5 months later. Okay, and that was quite a common thing. And now you have to understand that the body takes time to adapt. And when there has been a long-term chronic deficiency, you know, it may take years to get to that point. So it may take years for the body to regain its balance.
But I'm actually curious about the results that the doctor got, because there were results. So if somebody had like a heart rate of 60 when standing up, did that reverse eventually, or?
Yeah, in many cases, when there were not permanent structural damage or permanent structural changes to the body, many of the symptoms could be eradicated permanently, along with dietary changes as well. So if someone was consuming lots of sugar, they would have to go on a diet which was not containing all of that, because that was what led them to get to that point in the first place. But yeah, essentially what he found was some of these conditions, some of these symptoms, chronic nausea and vomiting, insomnia, headaches, migraines, as you've said, blood pressure, heart rate abnormalities, digestive symptoms, chronic digestive issues, a wide variety of symptoms spanning every single body system could be eradicated with this treatment. And now that's not to say that people are going to cure themselves with this vitamin, but that it has extreme therapeutic potential. Now, what I would like to say is that a chronic deficiency can go unnoticed for quite a long time. The reason I say this because it's important is because if you look back at Japan, when you had this population who were chronically deficient, it was often in the summertime that they would actually develop many of the symptoms. They would suddenly come on. It's theorized that this is because of the stressor. You need an initial stressor to sort of begin the cascade of things which ends in a disease state. So let me explain in a simpler way. Essentially, you can have a chronic deficiency that goes relatively unknown. Okay, when something happens, you have an initial stressor, something, it can be a vaccine, it can be medication, it could be an infection. Yeah, an infection was a common trigger. It can be UV light. It can be any stress. It could be a life event, you know, a loss of a loved one. Something happens which initially places a lot of stress on your system, and the underlying deficiency begins to manifest. And it's at that point that it starts to tumble downhill. Okay, and so he's found that it can be a dose of fluoroquinolones, it could be Gardasil. There is a lot of work being done on females who've had the Gardasil vaccine or the shot, and they've actually developed POTS and dysautonomic function, and they've been treated with thiamine, and that's helped quite a lot.
That makes sense.
Yeah.
That makes sense. And in diabetes, will it be so helpful? Because when you have neuropathic pain, like in a diabetic person, maybe it is more a thiamine deficiency, and it is not that the nerve is completely destroyed due to the high sugar state.
Yeah. Well, they've shown in type 1 and type 2 diabetics, one study, I believe, showed up to 50% less thiamine in the type 1 and up to 40% or 60% in the type 2. So they had roughly half as much thiamine as the average population without diabetes. And when you look at diabetes, what actually goes on in the cell in diabetes is very interesting, because if the cell can no longer turn around energy very fast, this is going to have downstream effects on whether it accepts more sugar into the cell. This can independently sort of tell insulin to shut off. And so thiamine deficiency has had very good results in diabetes, improving, actually to say that in non-diabetes, when you have imbalances in blood sugar, so you could have hypo or hyperglycemia, thiamine has been shown to be low in both of those cases, and it can induce those symptoms. Likewise, in different eating behaviors, so bulimia or anorexia, it can cause you to have a voracious appetite, or it can cause you to become disenchanted with food and not want to eat anything. And so they have also treated these kinds of people with thiamine as well, with good results. So it seems like there is a wide variety of different conditions, and as per Dr. Lonsdale's experience, it's a very safe treatment. Now, what needs to be said is that upon administering thiamine, what we need to understand is that many of the enzymes and the activities that thiamine helps to perform in the body also need other things. So one of those is magnesium. Magnesium is very important. And so what he found was sometimes when he'd administer thiamine to a patient, it could cause some problems, whereas only minor problems, maybe an exacerbation of some symptoms, heart palpitations and things. Whereas when he administered magnesium at the same time, he found that he got much more beneficial effects.
Right.
Likewise, what he recommended was actually prescribing magnesium along with the rest of the B vitamins to mimic nature, you know, in that sense.
But can you overdose in one of the B vitamins, or was it relatively safe when he megadosed?
Well, I don't think he megadosed the other B vitamins. I think it was a standard multivitamin complex, maybe a methyl B vitamin, where you have the standard doses, and it was just a high dose thiamine along with that. Thiamine appears to be very safe.
I see.
Yeah.
That's pretty interesting information about thiamine. The patients that Dr. Lonsdale typically saw was the POTS syndrome, right? And did you know about other cases where he applied the same research?
Yeah, so there were cases of learning difficulties, what we would probably call autism now. And there were cases of learning difficulties which seemed to improve significantly upon thiamine treatment. There were many cases of, as I've said before, gastrointestinal disturbances, vomiting, chronic vomiting, nausea, headaches, migraines.
Well, that got better with thiamine supplementation?
Yes, yeah. So he was using it on many different patients, and many of them improved. Not all of them, and it didn't necessarily cure them of everything, but it improved their symptoms significantly. And likewise, I believe he was also working with people with cardiovascular diseases. So arrhythmias, as I've said, palpitations, but also many other kind of conditions.
Probably atrial fibrillation.
Yeah, things like that. Well, yeah. His explanation was that much of the heart's electrical activity is coordinated via the autonomic nervous system, and so
through the
vagus nerve. And when there is low thiamine, this can potentially really break down the body's ability to regulate the stress system. And so another symptom is actually an overactive fight or flight response. So chronic stress and these kinds of things may actually be also exacerbated by an underlying vitamin deficiency.
That's interesting.
Yeah.
I think the key word here is the autonomic nervous system. That it basically everything that is automatic in your body is ruled by the autonomic nervous system. Right? So that's where thiamine can help.
Yeah.
I just think it's very interesting because we hear a lot about many other vitamins through mainstream research or even alternative research. Vitamin E, vitamin D, even B complex vitamins, even vitamin A, but you don't hear something specific about thiamine. Here I am. Even from the B complex, you hear a lot about B6 and B12 and niacin. Yeah. But what about thiamine? Why do you think?
I mean, that's such a good question. And in all honesty, I ask myself that all the time because it seems bizarre that something with such wide-ranging effects for so many different conditions would not have more publicity. And it seems like many people do not know about this treatment. And as you said, it's kind of like the dark horse or the lone wolf, you know, and it doesn't really get the attention that it deserves. But hopefully, with this book and with some of the work that's coming out now, hopefully more people and more practitioners will be able to try this, and hopefully we can have some more scientific research on the topic, because again, it seems like a very safe and effective treatment. And especially in our modern world where we are consuming more and more sugar by the day, you know. So,
who is at risk of a thiamine deficiency? Is there anybody in particular?
I mean, that's a very good question as well. And really in clinical care, in a hospital setting, you would be looking at someone with kidney failure or who has had gastric bypass. They are very common for thiamine deficiency. In anyone with anorexia or the elderly, and in anyone who is young, actually. So young children, typically children who are eating a very high sugar diet and who have a limited diet are at risk for thiamine deficiency. But when we're talking about the general population, it's also very applicable in our modern world, and I think many people probably do suffer from subclinical thiamine deficiency and don't really know about it. So it needs to be understood that we come into contact with many different toxins. Many of us take medications or over-the-counter medications, which are non-prescription, which also have a negative effect on thiamine metabolism. Anyone who consumes refined sugar or refined starches or even refined fats, these are all people who are at risk for thiamine deficiency. Now, anyone who has any kind of gut issues, gut dysbiosis, what we call it, or chronic diarrhea, something like that, there is a good chance that they may be lacking in some of the B vitamins, and thiamine is one of those. Aside from that, there is also mold. If someone suffers from mold toxicity, this is quite a common thing, I think. If you're living in a moldy house, then some of the mold toxins can actually have an effect on thiamine. They can deplete thiamine. And aside from that, really most of us, if we're eating a Western diet or a standard American diet kind of thing, then we are going to be at risk for this. And so ultimately, I think that in order to optimize your B vitamin status, if you're not going to supplement, then I would recommend switching to a whole foods diet. Ideally, if you're going to drink tea or coffee, drink it away from meals, and try to maximize the intake via whole foods, as I've just said, but really cooking methods is another thing. So boiling potatoes, if you're going to boil potatoes, a lot of the thiamine is actually going to be lost in the water. So baking it, you would maintain that. For pork, frying or something like that is